There's something pretty magical about being a psychotherapist, right? Every session is a new story, someone trusting you with chapters of their life, hoping you'll help them make sense of it all. There's a secret behind the magic. It starts with your clinical assessment. Assessment is both a product and a process. Your assessment acts as road signs, helping you know where you are and where you're going on the therapeutic journey. Developmental history, cultural background, ego strength, emotional capacity, verbal processor, internal processor, right brain, left brain, defensive mechanisms, client aggression, transference, trauma, emotional bandwidth. The larger system they're part of, their sense of power or lack of it, regulation of emotions, abstract thinking, concrete thinking, interpersonal focus, intrapsychic focus, diagnosis, openness. It's a lot. But you do it, and you do it well. There's a difference between being good and being magical. The shift from good to magical comes down to trusting your own assessment. Seriously trust it. Subtle cues, patterns, gut feelings, tiny inconsistencies. The way your client sits when they talk about their parents, none of that is random. You're gathering it for a reason. That's your clinical intuition, built on everything you learned in that thorough assessment. When you trust your clinical mind, something special happens. You're not just following a script. You see the real person in front of you. They have unique rhythms, how they process information, how they express emotion, what they defend against, how much emotional bandwidth they have today. You're tuning into their world and they feel it. That's when therapy goes from routine to transformative. Have you ever just irritability wasn't about their job but something deeper, a sense of powerlessness? Or realize they process everything internally, so your questions needed to be softer, more open-ended, giving them space to find their words? That's your assessment in action. When you trust it, you meet your client exactly where they are. It can be scary to trust yourself. We're trained to be careful, to check boxes and cover bases. Clinical magic isn't reckless, it's attuned. Let your knowledge, let your empathy, let your intuition work together. Your assessment isn't just paperwork, it's your compass. That's how you go from being a good clinician to a clinical magician. Thanks for listening. Remember, you've got this.